Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Doctor, what is a cochlear implant?
A cochlear implant is a fairly sophisticated device that's implanted into patients who have severe to profound hearing loss. Cochlear implants have been around for about 30 years and have significantly improved in terms of their overall technology and the outcomes that we see in patients.
How does it differ from a hearing aid?
A hearing aid is a device that allows amplification of sound, and so it really does nothing more than make environmental sounds louder. A cochlear implant actually improves the clarity of sound that patients can receive. So for patients with a mild hearing loss or a moderate hearing loss, they benefit a lot from a hearing aid, whereas patients who are deaf or nearly deaf can benefit from a cochlear implant. The cochlear implant is placed under the skin but over the bone of the skull. The main device sits directly above the ear. A tiny electrode then extends down through the inner ear to coil in the ear to be able to stimulate the hearing nerve directly. An external component that is like a hearing aid connects via a magnet in order to pick up environmental sound and transmit that.
How is cochlear implant surgery done?
Cochlear implant surgery is done in the operating room, and it's typically performed by making a small incision behind the ear where the implanted device is placed under the skin. A tiny little opening is made into the inner ear where a slim electrode is placed, and that electrode allows direct stimulation of the hearing nerve.
What is the outcome after surgery?
Pediatric and adult patients can do very well with cochlear implants, especially as the technology has improved in the last 10 to 15 years. We're seeing patients who are born deaf now be implanted at a young age and go on to have near normal speech and language development, which is miraculous considering where we've been for the past 30 years. Even in older adults, patients who undergo cochlear implants can do very, very well and have a complete renewal in their ability to hear and communicate with their families and loved ones.
How does a patient know if they would be a candidate for a cochlear implant?
Patients that have hearing loss can typically be evaluated by audiologists and determine whether or not they have hearing loss that would benefit from a hearing aid. Patients who have hearing loss that is no longer serviced or improved with a hearing aid should be evaluated for a cochlear implant. We're evaluating more patients nowadays to expand the types of patients that we can now implant, and we are understanding that patients who we previously didn't consider as cochlear implant candidates could be. So it's important to talk with your audiologist about that.